disease. We're here for you.
Now, this is pretty cool. Scientists at the University of Illinois have created a small heart monitor that can be applied to the skin as a temporary tattoo. This could potentially replace those bulky heart monitors used in hospitals and with outpatients. It can also be used to monitor brain waves and stimulate muscles. Dr. Dean Sutherland is here to talk more about this. And thanks for being with us this morning. This is really cool. This is such a small little device that can do so much. So tell us how this works.
I don't know exactly how it works. It has something to do with Harry Potter and magic.
Okay, a lot of things like that, all those science things. Okay.
But basically, they've taken the circuitry that's involved in Holter monitors, which normally we use to monitor heart rate in the hospital or as an outpatient, and they've been able to miniaturize it and then make tiny little waves in the wires so that it actually can conform to the skin. So if you move your neck or your head, it also bends and it doesn't break the wires.
And they described it kind of as a meandering river, and that's how it kind of conforms to your skin and picks up the data. And how is this useful?
Well, the heart monitors that we usually use, the Holter monitors, are very bulky and they're hard to apply. They fall off easily. They have little clips. This could be applied not only in the hospital, but also when someone's walking around. You could actually monitor how they're doing at home. It can be used even to collect brain waves, as you mentioned. They've actually been using it to control computers with voice monitoring, so that potentially if somebody couldn't speak, they could actually just make the movements, and the muscles in the neck could actually then control, a computer, or they're playing video games with them, actually.
Wow, so there's a lot of possibilities.
Very much so, yeah.
Okay, and so talk about why it's important to be able to get this type of feedback. Talk about what's going on in the patient's body.
Well, the things we worry about are heart rate abnormalities. It's called arrhythmias. When your heart is traveling too fast or too slow, or the beats are irregular, that's what we really need to know about, because those are the things that cause problems. They can be associated with heart attacks and strokes. And so if that happens intermittently, like if you're at home and you don't know it's happening, that can even be worse. It's called intermittent atrial fibrillation.
Okay.
And so that's associated with stroke in about 25% per year in people that have that.
Okay, so who would most benefit from one of these monitors?
Well, first we think it's going to be people that have cardiac problems to begin with, to be able to see if you're flipping in and out of this atrial fibrillation pattern, and then that could determine whether or not you need to go on blood thinners for the rest of your life. Later on, we think that it could also help with people with seizures. So if we could actually collect seizure data remotely, over the telephone or over even a handheld cellular phone, then that could tell us if people are having small seizures at home, and we'd be able to treat their seizure disorder better with medications. Because
so many of these conditions, things happen while you're not in the office. You need to be monitored.
That's exactly true. And a lot of times they come in and you don't get the full story, or if you have a seizure or a heart attack, usually you don't remember what happened.
Okay. And then when can we expect to maybe see these being used widely?
It's going to be quite a while. They have to make a good antenna, just like, in the cell phone, they used to have these big, huge antennas.
Yes, I do remember those.
Well, now they've figured out a way to do that using fractal technology to make these very tiny antennas in the phone. I think that's what's going to happen with these tattoos as well. So this will be the only tattoo that my children will be allowed to have.
Okay, and this is, like we said, a temporary tattoo, so just something you put on your skin. So, all right, Dr. Sutherland, thank you for being with us. Very cool. And now let's head over to Chuck, take a look at traffic.
We'll take it so far so good.